This is KUTV Primetime News with Irene Mwangi.
Good evening. Many thanks indeed for joining us here at KUTV News at 9, home to comprehensive and detailed bulletin on what is happening in the country and beyond our borders. Coronavirus status in the country continues to be dire, even as the Ministry of Health continues to vaccinate and inoculate people against COVID-19. The concern is the vaccine safe for the public? We are having Dr. Songok today to discuss the issue of the safety of AstraZeneca. I'm not alone tonight. Moses Gitonga is our sign language interpreter. Let's get started. The call to Kenyans to observe COVID-19 regulations in the face of the third wave continues to get louder as the Kenya Medical Practitioners and Dentist Union, KMPDU, added its voice urging adherence of the measures in the country.
At least 10 doctors are admitted in various health facilities in the country suffering from the coronavirus. A revelation that has compelled the Kenya Medical Practitioners and Dentist Union to campaign for strict observance of laid regulations to save health workers. In a statement to newsrooms, the union, apart from confirming full capacity in ICU facilities, also urged a quick contract renewal for doctors stationed in isolation facilities all over the country that the president ordered to be on standby. The union further asked the Health Ministry to increase sensitization and awareness programs for health workers shining the AstraZeneca vaccine. The warning coincided with Governor Alfred Mutuo's sentiments on Twitter, where he remarked on the full capacity in the Machakos hospitals, calling for Kenyans to protect themselves. A similar report was relayed by chairman of the board at the Kenyatta University Teaching and Referral Hospital, who said ICU beds were all occupied. 1,127 positive cases were reported today out of a sample of 5,393, 590 being male and 537 being female. Total cases are now 123,167, with the positivity rising to 22.1%. 210 recoveries have been reported, 110 from home-based care and 100 from health facilities, bringing total recoveries to 90,786. An unfortunate 25 deaths have been reported, raising total fatalities to 2,048. 135 are in ICU, and the plea is to Kenyans to observe the laid-down measures. For KUTV, I'm Emmanuel Kutosi.
Thank you, Emmanuel Kutonsi, for that particular story. Now let's move to matters business, where the national carrier, Kenya Airways, have recorded 36.6 billion shillings after tax loss for the financial year ending December 2020. This is triple the loss recorded in 2019, where the airline lost 12.9 billion shillings. The losses were exacerbated by the ongoing COVID-19 pandemic, which led to massive, consistent and capacity cuts affecting the aviation and travel market.
Kenya Airways has said its pre-tax loss for the last year tripled to 36.57 billion Kenya shillings as the coronavirus crisis hit demand for travel. The airline chief executive Alan Kilavuka said passengers' numbers dropped significantly during the year under review to 1.8 million compared to 5.2 million in 2019. Due to coronavirus pandemic, there has been a 50% drop in seat capacity, a 30% cargo yield growth, $370 billion drop in gross revenue, and 57.6 available KMS seat. The total number of passengers carried in the period, for instance, fell to 1.8 million individuals in contrast to 5.2 million in the preceding year. It has been a tough year where we have faced unprecedented challenges. The situation continues to be difficult even as we gradually resume our operations, mainly due to the depressed demand for air travel, with recovery to 2019 levels expected to take between 3 to 4 years, said the airline in a tweet. Approximately 70% of total passengers carried last year were flown during the first 3 months of the year, demonstrating the drop in demand as the global crisis deepened during the year. The Kenya Airways losses are also attributed to the collapse and halt of its operation across 2020 due to COVID-19 related disruptions. The management nevertheless remains optimistic and has pointed out that the Airways has saved an estimated 6.6 billion shillings in loan moratoriums by its debt holders. The carrier is targeting tighter cash controls to survive the current crisis. Njoki Wanjiku, KUTV.
Thank you, Njoki Wanjiku, for that particular story. Now, still on matters economy, the onset of COVID-19 pandemic has forced many businesses to reinvent themselves in order to survive the hard economic times. Tough measures imposed by the government in 2020 that included closure of Kenya airspaces in order to avoid importation of coronavirus in the country left Bahraini women group members who heavily rely on tourism devastated. In order to survive the harsh economic times, the group has changed its line of business and it's now making soap. Stacey Atieno reports.
During the pre-coronavirus era, the coast region enjoyed over 2 million visitors yearly. The number has decreased to 471,000 in the past year as a result to measures employed to contain the spread of the virus, such as lockdown and flight restrictions. Bahraini women group that previously depended entirely on the tourism sector has been forced to reinvent their business model in order to survive the economic turmoil. The group has resulted to making soaps a business idea that is slowly gaining momentum and could soon become a game changer to their lives if they are accorded the necessary support.
Sasa tungeomba kupitia kwa serikali kuu ama kwa serikali yetu ya county ili itusaidie na mafunzo vile tutakavyoweza kuuza hizi sabuni zetu kwa kiwango cha juu.
The new venture, though still small, has enabled them to stop depending entirely on the tourism sector for survival. The advantage of the venture is that they are able to produce the soap at their place of work during their free time at the beach. The idea was born during one of the Malindi town cleanups, which was attended by youth working under the Kazi Mtaani program initiated by President Kenyatta. Such innovations will help youth and women to earn income from their work even when tourism is doing badly, while the youth will be able to continue earning after the expiry of Kazi Mtaani. Stacey Atieno, KUTV.
Now, to a sad story, Jubilee Party Executive Director James Owero has died at Karen Hospital. The former sports PS died on Tuesday morning after he collapsed. Jubilee Secretary General Raphael Tuju eulogized his colleague as sober, passionate and moderate. The deceased took over the party's operation last year in February following Tuju's road accident. Alright, now let's take a fast breather, but we have a lot more prepared for you on what is happening in the country and beyond our borders, including our discussion tonight concerning the safety of coronavirus vaccine, that is AstraZeneca. Do stay tuned. See you in a moment.